all of the times that I literally begged and pleaded for treatment, and I was just reassured it was nothing, go on the waiting list, and, 7 months lapsed between my initial referral to the time I saw a gynecologist, which only happened because I did end up in the emergency room. But for 7 months, I begged and pleaded for somebody to listen to what was going on with me.
Cancer patient Lori Anderson begging, pleading, month after month for treatment she needed. As we reported here last week, our healthcare system failed to diagnose the cancer growing inside her, and our glacial medical monopoly allowed the cancer to grow as she agonized on waiting lists month after month, treated like a number instead of a patient in need, putting her life at risk with a much lower chance of survival. Her story makes me burn with anger over the treatment Lori received. Universal Canadian healthcare is becoming nothing more than equal access to bad treatment. The whole system needs a fundamental shift in attitude. And as I've said here before, you and I are customers, but we're not treated like customers. Our tax dollars pay for healthcare. Approximately 50% of Canadian provincial budgets are funneled into the hospital system. But because of this archaic, out-of-touch medical monopoly, there's no consequence for lousy service. And you and I, the customers, have no choice in the matter. It's all we've got. And we keep sitting here hour after hour in emergency rooms, month after month, on surgery waiting lists, and far too many of us have gotten used to it, convinced that this misery of waiting is just the way it has to be, not realizing there's a much better way. Well, there is a better way. Many Canadians have sold themselves on the benefits of universal care. There's that deeply ingrained fear of private care, that we'll end up with some sort of American-style health care. God help us. But allowing private care should not be scary. It's time we looked beyond the fear-mongering and took this seriously. Private care should be viewed as a salvation. Instead of wringing our national hands with worry over the apparent shortcoming of U.S. care, let's look to the Germans for inspiration here. When it comes to health care, it's time for some German common sense. Frederick Roeder, his name, a German economist, has just completed a report for the Montreal Economic Institute comparing Germany's healthcare system with Canadian healthcare. Both countries spend about 12% of total GDP on healthcare. But German patients don't have endless emergency room waits. They don't share in Canadian frustration. They're effectively getting better care for the same price. Why? Well, for starters, only 31% of German hospitals are fully public. Germany has undergone a gradual privatization over the last 2 decades. And guess what? Healthcare services have improved without affecting patient accessibility. Forget those fears that private hospitals cut corners on patient care. That would simply be dumb. Patient care is a priority because private hospitals face competition from the public system to keep them honest. The success of the hospital depends on its reputation. The private hospital has real consequences if they don't do a good job. They could even go out of business. In fact, organizations that monitor and ensure proper care actually found that public hospitals had 9% more patient problems than private hospitals in Germany. And the reason is crystal clear. They don't have the same accountability. Once again, the problem with the Canadian system is there is no accountability, no consequences for offering a poor product. Where's the motivation? It's time Canadians realize that there is a better way, that we don't have to gather cobwebs in the emergency rooms on the waiting lists across Canada, that we're not going to take it anymore. Horror stories like Lori Anderson should be a wake-up call to all of us. It could happen to any of us. The Canadian system is letting us down, and our complacency is allowing it to happen. It's a double-edged sword of poor service and wasted money. We need to end our national fear of private health care. It would augment the care we receive, not replace it, augment. The universal public care medical monopoly is not helping Canada. It's holding us back. It's time to give us the freedom to put our own lives in our own hands. That's Canadian common sense. Curing Canadian healthcare, why Canada should be more like Germany. For further insights, we turn to Michel Kelly-Gagnon, CEO of the Montreal Economic Institute. Mr. Gagnon, please give us your prescription for the German model tonight.
Sure. Well, first of all, the German model is part of an overall trend in Western Europe and in the Scandinavian countries. It must be said, and your listeners and your viewers must first know that all these countries, including Germany, that we'll be talking more in more details in a moment, have universal healthcare system. So in Germany, for instance, 90% of German people are covered by the government insurance, and the 10% that are not covered are covered by a private insurance of their choice. So everybody's covered, nobody's left behind. You have about 1/3 of the hospitals who... You have about 1/3 of the hospitals who are private for-profit, 1/3 who are private non-profit, and 1/3 who are government-run, either by the states, the landers, or the municipalities. So you have a mix, and that's the key thing. German people have choice. They have universal health care. It doesn't cost them more than Canada. Actually, if you adjust for the age of the population, the German system is less costly than Canada, and they have no waiting list in the emergency room and something like 10 days of waiting list for specialized services. So, you know, I mean, it can be done. It's not like it's rocket science. It can be done. Same thing with Sweden.
Michel, let me just throw out a couple of the things the fearmongers always throw out, because we got to knock these out of the park right now. Sure. Number one, that poor people don't have access to the best health care. What's your take on what happens in Germany and Scandinavia? The fearmongers say that poor people will have very, very poor access to health care. They certainly won't have access to the really good stuff.
Well, again, that's just factually inaccurate. In the case of Germany that we've studied extensively, they have access to care. And as a matter of fact, unions and even socialist parties in Germany, I mean, support this situation. So if it was against poor people, they would protest. And what they did instead is they have, you know, their own hospitals to provide with services. And the reality is that not only is nobody's left behind, but in the case of private for-profit hospitals, they spend on average, the doctors that is, 25% more time with their patients, and this is even if they're paid out of a flat fee. So they don't have an economic incentive to dwell and spend more time, and yet they do spend more time. Why is that? Because of reputational issues. They want customers. They want to attract people, because if they don't attract people, they will go out of business. And when I
Michel,
say this,
let me get in with a couple more here, because I can just smell what they're saying out there, the ones who hate this discussion in this country.
Sure.
Number two, that the people in the public health care system will never get access to the good doctors, because the good doctors are going to be making all this money, becoming filthy, stinking rich in the private system, and none of the good doctors will work in the public system. Michel, go.
In the case of Germany, it doesn't change. It doesn't change anything, because everybody has access to the good private hospitals, including poor people, because they're all paying the same amount. So I don't know for a fact if the good doctors go more in the private hospitals, but even if it was the case, the poor German people can go into those private hospitals. That's the whole point. They have universal health care. Hospitals in Germany are not allowed to refuse anybody, and they are getting paid the same amount whether you're rich or poor.
Now, of course, the other thing the fearmongers always say is the only way that private hospitals and private insurance companies can make money is to do what those Americans do, and that's knock people out if they've got pre-existing conditions, and if they develop serious conditions, to deprive them, to take away their insurance. Got 30 seconds for that one, Michel.
Completely false. Is the reverse. The private hospitals in Germany take more heavy cases than the average, and that's the government of Germany monitoring that in an independent way.
Michel Kelly-Gagnon, we'll have to discuss this further down the road. It's an incredibly important discussion that we've initiated here tonight. Thank you so much, sir.
Thank you for having me.
Michel Kelly.